All right, sorry. Every time I press record, Oliver all of a sudden comes in front of my computer. So continuing on with lecture 21, we're going to talk about EEGs or electroencephalograms. There we go. So there have been lots of different ways that we have tried to study sleep. So one of the first discoveries was that during certain stages of sleep, while our eyes are closed, they are actually darting around and looking in different directions. And that has been called rapid eye movement, or REM. And it's seen in some parts of sleep and not other parts of sleep. So that's one of the things that we have looked at to kind of understand what is happening while we are asleep. The other is changes in EEG patterns, and we're going to talk about EEGs in a minute. But then we also look at changes in heart rate and blood pressure, respiratory rate, your metabolism. So if you ever, or someone you know or love, ever gets a sleep study, that will produce what's called kind of a polysomnogram, where we look at all of this data together to get a picture of the different things that are happening in the body. So the study of sleep is fascinating. So an EEG, or an electroencephalogram, is basically an electrical readout of brain activity. It is absolutely the analog to an EKG, where we put electrodes on the front of a person's chest, and that allows the machine, the wires, to detect the electrical activity that's happening in the heart. This is the same exact thing, but those electrodes are put in all these different specific spots on your scalp. And then they are able to pick up, so they're just sensing, they're not giving you electricity. It's able to pick up the electrical activity that is occurring in those parts of the brain. Now, because they're very close to the surface, right, just the surface parts of the brain, they're not so good at telling what's happening deep in the brain because that's kind of too far away. And it's also important to acknowledge that this is just saying, like, are we seeing a lot of activity or a little activity in this general region of the brain? It's not telling us which specific neurons are firing or why or which neurons they're specifically talking to. It's just kind of an overall gestalt, like a bird's eye view of, is there a lot of neuronal activity or is there not a lot of neuronal activity? So when we hook somebody up like this with all these wires, it's going to make a tracing, just like an EKG does. And so this is an example that we're seeing now of an EEG tracing from one of these leads, right? So there's all these different electrodes, we call them leads, in the different places. This is looking at information across one. So when you have a really high peak like this, that means there's a lot of neuronal activity happening. A lot of neurons are firing, so we see an increase in the voltage. And then you can see how it kind of goes down, and then there's not a lot of firing, and then there's a lot of firing, and then there's a not, and then there is, and then there isn't. So we can also see that it kind of comes in these periodic bursts or waves, hence brain waves. And so if they're happening frequently, well, that's going to produce a high frequency tracing where we see lots of ups and downs. Whereas if they're happening infrequently, we're not going to have as many ups and downs. So EEGs are pretty crude overall and non-specific, but they can be useful. So they're not telling us exactly which neurons are firing, part of which pathways, why, and who they're talking to, but we can just get a general gestalt of overall brain activity. So this is what an EEG tracing looks like. So again, we have these patterns or waves where there's a lot of activity, not as much, a lot of activity, not as much, a lot of activity, not as much. And then also acknowledge that different parts of the brain are going to have different activity levels. So for example, look at these guys over here. We see a lot of high amplitude here, and those are in the temporal region. So I don't know, is this person listening to something? I have no idea. Whereas we, look at this is in the frontal region. Not a lot seems to be happening there. So it's not going to look the same in every part of the brain at any given moment. Now, why does this happen? Why do we see bursts of activity and then none, and then bursts of activity and then none? We're not sure. We think maybe it's just part of how neurons communicate, right? Because it's a boom, 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 one to the other as they're sending their action potentials, and that sets off an action potential in the next neuron. Or maybe it makes it easier for them to communicate with each other if they do it in bursts. We're not really sure. But we also know that there are different wave patterns in terms of amplitude and frequency that are associated with, meaning we tend to see them more during different levels of consciousness and alertness. So that's why this is relevant to our discussion of sleep and why we're talking about EEG now, because much of what we know about stages of sleep comes from things that we can see on an EEG. Overall, researchers have decided to categorize brain waves seen on an EEG into 5 different basic patterns, and they named them with Greek letters. So the pattern that we see up here, where it's not very high in amplitude, but lots of frequency, right? So very high frequency, that we see when we are most alert and most cognitively active. Whereas then you can see down here, this is kind of our lowest level of alertness. This happens to be deep sleep. We see some really high amplitude waves, but very low frequency, sometimes just 1 or 2 per second. Now notice that these waves aren't smooth, right? They're not perfect. They're not like what we see with a sound wave, for example. And that's because not all the neurons in any given region of the brain are all synchronized like this, right? Some of them are beating to their own drum. So it's not perfect. It just gives us this general idea of what most of the neurons in this area seem to be doing most of the time. It's just an overall average. So these 5 different brainwave frequencies that have been described and categorized. So gamma waves are the ones that are the lowest frequency in general, or highest frequency and often the lowest amplitude. And we tend to see gamma waves when people are really locked in, they're really focusing, they're working hard on a problem, they're concentrating on something, problem solving, maybe doing a complicated dance step, right? So you're really kind of focused, your brain is really, really busy. That's when we see gamma waves, lots of neuronal activity happening very frequently. Then the next is slightly lower frequency, slightly higher amplitude is beta waves. So this is when you're awake and you're thinking about things. Maybe you're watching a lecture, I don't know, right? So you're noticing things around you. You could be concentrating on something, but you're not like super locked in. So that's what we tend to see on the EEG is beta waves when people are in that state. Moving down, the next one is alpha waves. So this is kind of your light relaxation. We find alpha waves in people when they are doing light meditation. This would be if on a nice sunny day, you're kind of laying out on the grass, closing your eyes, feeling the sun on your face, just enjoying life. Those we see with alpha waves during those types of states. Next is theta waves. Now, these can be seen in deep meditation, but they're also seen during sleep. So now in here where it says creative, recall, fantasy, I don't know about that. There's a lot of kind of woo-woo stuff out there about brain waves, and I'm not expert enough to parse that. But definitely we see theta waves during a lot of our sleep. And then delta waves are the slowest. So the lowest frequency and often very high amplitude. And this is when you are deeply asleep. So this is often referred to as slow wave sleep because these delta waves are very slow. You're not dreaming, you're totally out of it. It's hard for people to wake you up. That's when we see delta waves. So the EEG has been useful for helping us realize that different things are happening while we're asleep, and we have different stages of sleep, but it's also useful for the diagnosis of folks who have a seizure disorder. So we know that seizures are due to some sort of abnormal electrical activity that gets going in the brain, abnormal neuronal firing, which may cause muscle actions or may not, depending on the type of seizures. And during a seizure, we can actually see that abnormal activity. So here is an EEG of somebody having a seizure, which you can see is very different than the normal awake brain up here. Now, what's interesting is that somebody who has a seizure disorder, or epilepsy, as it's often called, when they're not having a seizure, their brain waves often look different even then, right? So that's kind of an interesting thing that can be useful to neurologists and people who are trying to make a diagnosis in someone to figure out what might be causing their symptoms. So in summary, EEGs, right? They developed as one of the ways in which we characterize sleep. So other things we look at to help understand what's happening during sleep are for that rapid eye movement, respiratory rate, heart rate, blood pressure, muscle activity, all types of things. So EEGs just show us neuronal activity in a region of the brain kind of writ large. Like what's the overall, are a lot of neurons firing or not a lot of neurons firing? That's all it really tells us. But interestingly, it tends to go in these pulses or these waves. So they are a crude way of looking at the brain, but they can be very useful. They certainly are very useful in diagnosing seizure disorders. And then we also see it's useful in categorizing stages of sleep because we see different types of wave patterns with different levels of alertness. So remember, the gamma waves were the highest frequency ones when you're really locked in and thinking hard. Beta was when you're awake, you're thinking about things, but not concentrating and working quite so hard with your brain. Alpha is that light relaxation. Maybe you're falling asleep. Maybe you're just enjoying the feel of the breeze on your skin. Often your eyes are closed when you're having alpha waves, light meditation. Then there's theta waves, which is kind of the next deepest, and then delta, which are the deepest sleep waves that we see, very low frequency and high amplitude. So that's it for EEG and brain waves. Next, we'll talk about the stages of sleep and the sleep cycle.